Today we are in Montpellier, and this will be a 100% Occitanie session, as I have the pleasure of welcoming Marie Farouche, who comes from Toulouse. We will present to you the anatomy and ultrasound imaging of the trunk walls. Marie will present the posterior parts of the trunk, and I will cover the imaging of the anterior thoracic and abdomen wall. Catherine, thank you for having me. We will now see how we perform an ultrasound of the anterior wall of the trunk. We will examine in sequence the thoracic wall, focusing in particular on the pectoralis major muscle, the pectoralis minor, the serratus anterior, and the intercostal muscles. Then we will move on to the abdominal wall with the rectus abdominis and the three superimposed anterior lateral muscles, the transversus abdominis, the internal oblique, and the external oblique. Let's begin right away with the anterior thoracic wall. The first thing to explore is the bony and cartilaginous structure. The rib cage is made up of 12 ribs, as you know. The first 5 ribs are directly attached to the sternum via their cartilage. The next 5 are connected to the ribs via their cartilage, and the last 2 are floating ribs, not connected to the sternum. On ultrasound, as on this sagittal CT scan, we can see both the bony surfaces and the cartilaginous joints that separate the 3 parts of the sternum, as well as the xiphoid process, which is often cartilaginous and not visible on X-ray or CT. Let's start with the deepest muscles, the intercostal muscles. They consist of 3 layers. The innermost layer is made up of the innermost intercostal muscles, which are directly adjacent to the lungs. More superficially, we visualize the internal intercostal muscles, then the external intercostals. These muscles have differently orientated fibers, allowing the rib cage to rise and fall. The pectoralis minor is a triangular muscle with a broad base that originates from the anterior parts of the 3rd, 4th, and 5th ribs, just before the cartilage. It then extends upwards and laterally to insert onto the medial part of the choroid process. The most important muscle of the anterior thoracic wall is the pectoralis major. It has a broad origin from the medial third of the clavicle, the entire sternum, and the lower down from around the 10th and 11th ribs. We distinguish 3 parts: the superior claviculum portion, the superior sternal portion, and the inferior sternal portion, which occupies the lower part of the sternum and the costal area. These 3 muscle portions extend laterally and twist around each other to insert onto the lateral lip of the bicipital groove. Let's take a moment to more specifically describe the humeral insertion of the pectoralis major tendon. There is a prominent U-shaped tendon with the base pointing downwards, representing the upper sternal bundle in front and the lower sternal bundle underneath. The clavicular bundle remains muscular for longer and is often visible in front of the main common tendon of the sternal heads. This clavicular head has a close relationship with the deltoid, and we find this V or U-shape form between the deltoid and clavicular head, often called the deltopectoral tendon. Some describe this deltopectoral tendon as a separate from the main sternal tendon, passing in front of it and inserting with it the deltoid lower down on the anterior lateral humerus. On ultrasound, it is possible to identify the medial and lateral pectoral nerves running along the pectoralis minor, which innervate both the major and minor pectoral muscles. The last muscle of the thoracic wall is the serratus anterior. It originates from the medial border of the scapula and, via large digitations, inserts onto the ribs from C1 to C12. It forms the deep surface just in front of the ribs on the lateral part of the thorax. With ultrasound, we can also see the long thoracic nerve starting from the subclavicular area and extending along the surface of the serratus anterior. Now let's begin the practical ultrasound exploration, starting with the anterior thoracic wall. When scanning the thoracic cage in sagittal section, we clearly see the bony structure of the sternum, the junction between the manubrium and the body of the sternum, and lower down, the xiphoid process. You can see that the xiphoid process is largely cartilaginous. Laterally, we see the costal cartilages, which may appear elongated. Beneath the cartilages, we see the pleura and the lung, and the insertion of the costal cartilages onto the sternum. Continuing laterally along the cartilage, we see the junction between the cartilage and the rib, with the upper cortex visible and the lung no longer visible beneath. Here is the junction between the costal cartilage and the rib. The large superficial muscle occupying most of the anterior thoracic wall is the pectoralis major, so let's begin with it. We saw that it inserts widely on the medial third of the clavicle, the sternum, and certain ribs. You can clearly see it outlined here. If I place the probe transversely across the sternum and slightly lateral to it, we see the pectoralis major extending widely across the thoracic wall. In a parasitical view towards the top, we see the clavicular portion, and it is easy to distinguish it from the sternum portion of the pectoralis major. Moving down, we can trace the entire muscle, which is eventually joined to the abdominal wall muscles in the lower region. Let's now explore the lateral portion of the pectoralis major. To clearly visualize the lateral insertion of the pectoralis major, we ask the patient to abduct their arm, which allows us to see the lateral part and the tendon inserting into the biceptal groove. In a transverse axial view of the pectoralis major, we see the large superficial muscle and continue towards the humerus. Here, we see the main tendon of the pectoralis major, directly above the humerus, with the long head of the biceps just beneath it. On the surface, we see the two muscles separated by a hypoechoic structure, the deltopectoral tendon. On the outside of the deltoid, and on the inside, the clavicular portion of the pectoralis major. At the surface of the pectoralis major tendon, we see a V or a U-shaped convergence of the clavicular and deltoid tendons, which adhere together and extend further downward to join the deltoid insertion more distally. Looking again at the pectoralis major tendon, we see intermuscular bundles corresponding to two layers. The superficial layer, which is the upper part of the sternum bundle, and the deep layer, corresponding to the lower part of the sternal bundle. These converge into the tendon. On ultrasound, we cannot usually distinguish the two parts of the tendon, although we may sometimes see a small hypoechoic line separating the upper from the lower sternal bundle. Now let's continue with the next layer, the pectoralis minor. With the probe placed axially above the nipple, we see the pectoralis major on the surface and the pectoralis minor underneath. Already visible is a small neurovascular bundle perforating the pectoralis major and clearly visible between the two muscles. It corresponds to the pectoral nerve, innervating them both. As we saw, the pectoralis minor inserts on ribs C3 to C5 and then ascends and inserts on the medial part of the coracoid process. Rotating the probe slightly longitudinally, we can follow the path of this muscle down to its insertion on the ribs. Now let's examine the deepest part of the anterior lateral thoracic wall, the serratus anterior muscle. At the upper part, in transverse axial view, we see the serratus anterior deep to the pectoralis minor. Between them, we can see the small neurovascular bundle corresponding to the long thoracic nerve. Raising the patient's arm allows for a better view of the serratus anterior muscle. Our landmark is the spinal tip of the scapula, visible here. Laterally, we can see the serratus anterior along the ribs. On its surface, we can trace the long thoracic nerve running along the muscle. Rotating the probe 90 degrees reveals again the long thoracic nerve running over the serratus. Superficial to this serratus anterior, we find the latissimus dorsi, which Marie will discuss shortly. Let's first finish the exploration of the anterior thoracic wall muscles by examining the intercostal space, where we see the superimposed layers of the three small muscles, from deep to superficial. The innermost intercostals, the internal obliques and the external obliques. Beneath them, the pleura and the mobile lung are visible.